It's January 26, 2023. I'm in this flag system. I'm in this monetary system for United States of America and the Federal Reserve notes. Um, this would be the General George Washington. Um, this is what's on the back for symbology. Um, Now, I was in my residential area, district and zoned, the other night with my son. Um, it was October 23rd. We were going to buy a birthday card and Pokemon cards for whatever. I took my son up to Rite Aid, and we entered the store. And I know I'm on surveillance camera. I mean, you're on surveillance camera around here, no matter where you go, just so the camera crew knows that I know. But I don't remember, and I wasn't taking inventory of the man's name on his name tag. And I actually was looking for the receipt, which I think Linda might have thrown out, um, for the register number. But there was a new employee in Rite Aid that I had never seen before. And when he extended his hand to collect the money from my son and myself at the register, right at the nook of his hand, he had a dermatological presentation. Um, it almost looked the color of a lemon peel. Um, I don't have the training of the disease process to know exactly what this dermatological presentation or occurrence was. Um, I don't know if it was like a cyst. I don't know if it was a pustule. I don't know if it was a form of a scab. I but my son, who is not in advanced disease process whatsoever, um, is interacting with this person behind the register who has on his, um, his digital, not digits, but his phalange, like somewhere right around this section. And as far as vector fomite transmission of potential hazards, it's a concern for me. At visual inspection, I mean, and demeanor of this person, which really is irrelevant at like public health and concerns of communicable diseases, especially passed on if you think of the children as the keys to the future, the keys to the castle, the keys to the future, um, in a home maintenance kind of a way of protecting the young, for the future. I'm concerned that somebody would employ this person in the district and zone that I'm living. It's within my footpath. It's at the local pharmacy, the local drugstore, and this person is working. And I've worked that position before as an intern in high school. Um, at the time, the company was called Genevieve's before Rite Aid took over. Um, and so I'm concerned. I'm concerned. I don't know who is in charge of the labor, allowing this person to be employed at this position and interacting with the unsuspecting public. I don't know who the health minister in charge of making sure things like this don't slip through the cracks and accidentally infect the public. I don't know if this, um, dermatological presentation is like a transmittable vector, but I'm not a gambler. I don't gamble on my son's health or my own, and it's not acceptable for someone to be employed working with money and working at the register with the unsuspecting consumers, it poses a larger public health threat to whatever is doing business or whatever is residing in the local district. I don't know where to voice that level of concern to. It's not a personal issue. The person was very pleasant, had a very nice demeanor, um, and was very gracious to me, my son and myself. I'm just, he was not wearing gloves to dress the potential hazard. That was one concern, level of concern. But it was exposed, and I don't know what it was, but it is a concern because I don't want that level of exposure. I don't want my son to ever wake up with something on his body that looks the way that that looked, which it's just, and I also want to protect the other people in the community. Um, so I don't know how to raise that level of awareness and concern. I don't know who collects that level of information and handles it discreetly, but I don't know the person's name. But again, camera crew might know. And it was the first time I had ever seen this person at the register. Um, I don't know it. Again, I'm not sure of the local inner workings, um, but I'm not all right with that level of infection and an advanced disease process and like it looks like a sore of some sort, um, interacting with the public. Um, it's star 1978, star 8378, Nicole Cattaruzza. It's Earth, solar system, Milky Way universe, galaxy is broken, and it's Bayside Station, Bayside, New York, 11361.